The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and welcome to the NOFA Planning and Advocacy webinar. We're going to go ahead and get started now. My name is Kate Seif, and I'm here on the webinar today with my colleagues Norm Suchar, Director of Capacity Building here at the Alliance, and Kelly Kinghorn, Executive Director of Homeward in Richmond, Virginia. Homeward in Virginia serves as the Continuum of Care lead for the City of Richmond, so they are leading the application process in that community. And then we'll have Anna Blasco and Lisa Stand helping us out with questions at the end. Today we're going to review the best ways to approach the fiscal year 2013 NOFA that I just released to have the biggest impact on ending homelessness in your community and how you can work to ensure that we never have to operate under a funding shortfall again. A few quick webinar logistics before we dive in, just to remind everyone that your lines are muted and we will be taking questions at the end. So you can submit a question at any time throughout the webinar on the control panel box on the right-hand side of your screen. Just go ahead and type it in and we'll receive it and get those questions answered at the end. So as soon as you have one, don't wait till the end, go ahead and submit it. And again, we'll answer as many of them as possible at the end of the call. And we've got a lot to cover today, so please do bear with us. I would also like to remind folks that if you're having any audio problems, try calling in through the numbers that's provided on your control panel box instead of listening through your speakers on your computer. That might help a little bit. And of course, we will also post a recording of this webinar up on our website as soon as possible. And make sure that we get the recording sent out to all of you that signed up for the webinar, along with some of the materials we'll be discussing on this call. So just to run through some agenda items really quickly, we've already done the welcome and introduction, so we're flying along here. We're also going to be discussing where things stand in the federal budget process to give you an idea of what the possible funding outcomes are for fiscal year 2014 funding for McKinney programs, what the next steps are, and of course what you can do to make sure we come out on top in the final funding bills and some other advocacy actions you can take to have an impact. Next, Norm will be delving into the details of the NOFA, covering some of the most salient details, important things to note, and then discussing possible approaches to filling out your application with, of course, an emphasis on the approaches that will earn you the most points and have the biggest impact on ending homelessness in your community. Then Kelly will be talking about Richmond's approach to the application, along with some important actions they've already taken, why they took them, and why they took them to earn maximum amount of points. Kelly will also be discussing why her community engages in federal and state advocacy to have an impact. And finally, of course, we should have plenty of time for question and answer at the end. As a reminder, as soon as you have a question, go ahead and type it in. And we will be recording this webinar and putting a recording up on our website. So just to recap where things stand in the federal funding process for fiscal year 2014, which of course began officially on October 1st, 2013, I thought this would be important to cover to give you all kind of an idea of what the likely funding outcomes were. And of course, as you know, federal funding is directly linked to the Continuum of Care NOFAs. So there was a conference committee that was created out of the End the Government Shutdown deal in mid-October, and they completed their mission to come up with a total spending number for the federal budget for fiscal year 2014. Previously, throughout most of 2013, the House and Senate were working under completely different numbers, and as a result, spending bills were kind of getting nowhere. So this conference committee came up with about $1 trillion for the federal government to spend for fiscal year 2014. That's more than the House was using to write its bills earlier this year, but significantly less than the Senate was using when it wrote its own funding bills earlier this year. So there's some definite discrepancies there. In addition, the conference committee came up with a deal that includes easing sequestration, the automatic across-the-board funding reductions implemented back in 2011. The deal will put back about $63 billion into the federal budget over 2 years, offsetting those costs with increases in various fees, particularly focused on federal worker retirement plans and pensions and a few other things. So now that appropriators, and appropriators are the folks in Congress in charge of the federal funding process, have clear next steps, they will be working very quickly to finally finalize those fiscal year 2014 bills they've been working on all year. And like I said, because they now have a new top-line funding number, they're going to need to redo all of their funding bills. So they're sort of working with a blank slate. And it remains unclear at the moment which direction they'll take or what it may mean for HUD funding. Theoretically, the final HUD funding legislation will fall in between the bills produced by the House and Senate. But since those bills were never finalized, it could go in a few different directions. The deadline for them to figure it all out is by January 15th, when the current stopgap funding measure, funding the government, expires. By all accounts, it seems fairly likely that they will pass something by January 15th to avoid another government shutdown. Since I keep talking about the Senate and House funding bills and how they varied, I just wanted to give you an idea of what those bills mean for funding for the Continuum of Care and the Emergency Solution Grants. As you can see, there's some pretty big differences. The Senate's funding level, that $2.26 billion, it would provide a hefty amount for ESG, so a big increase over last year's ESG allocation, and get us back to our 2012, our FY 2012 COC levels. So before the current 5% cuts we're talking about today. So it put a little back into the COC. The House level would provide very little ESG funding, so it would keep us flat for that ESG and keep us flat, debatably flat, give or take some reallocations and things like that from the 2013 NOFA. So we're not, if the House budget passes as is, we're not looking to expand the COC any further next year. And we'll have to keep the programs that we're cutting this year cut. And finally, the administration's proposed number would, of course, be ideal with a lot for ESG and even some money in the COC for new projects. So like I said, it remains unclear what the final funding level will be, but obviously we want to make sure it's as close to the administration's level as possible to ensure that we have as much money to work with as we can. As I've been alluding to, and as you all know, this NOFA is requiring you to tier your projects with up to 5% of your continuum eligible to be cut. And I want to make it clear to everyone that this tiering requirement and the potential cuts your continuum might face are not a HUD decision. They are a direct result of sequestration, which was the across-the-board cuts to fiscal year 2013 funding that happened back in March. Along with congressional decisions to just not provide enough funding to renew all existing projects. That was a very deliberate decision made by Congress, and it was a decision, I just want to be clear, it was made by Congress. So the resulting NOFA, the one that just came out, is really the best HUD could do with recaptures and to ensure that as many renewals are funded as possible. While recent decisions, the conference committee's whole big budget deal, will alleviate sequestration in the future, it unfortunately does not reverse it. So the cuts you're dealing with right now are here to stay. The best thing we can do right now is to work to make sure this won't be a recurrent thing. And as such, we have an opportunity to sort of work with this blank slate that I was talking about with the FY 2014 funding to make sure that this doesn't happen again and that next year we get a sufficient increase for McKinney programs to fund all renewals and maybe even get some new projects. To be clear, if McKinney does not get an increase next year, so if things stay flat or you know, even a very slight increase, we will have to do this process all over again. So unless McKinney sees a hefty increase next year, we're going to have to do this tiering cut process all over again, and the cuts could be worse than just 5%. So I'd also like to change gears a little and also mention Medicaid expansion. And Norm will talk a little bit more about this, but of course you've probably all read through it. The NOFA encourages continuums to coordinate with other sources that fund services to people experiencing homelessness. It also specifically encourages COCs and homeless programs to engage with health care enrollment under the Affordable Care Act. In all states, regardless of their expansion status, homeless providers have opportunities to link people with Affordable Care Act, ACA benefits, and programs that can help them. So some people experiencing homelessness may qualify for a subsidy on the new health care exchange in their state. And as we've been talking about, many low-income people have better access to community health services as a result of the ACA, which is great. So that's something to keep in mind as you work on your NOFA and on your general efforts to end homelessness. ACA offers a lot of great opportunities. The most significant ACA provision, of course, expanded Medicaid eligibility, does unfortunately not apply in every state. It's just an unfortunate reality of how this played out in politics. Around half the states have so far not chosen to expand Medicaid under the ACA, even though generous federal subsidies, of course, are available for expansion. But in communities where states are not expanding Medicaid, homeless service providers have far fewer opportunities to help individuals who need health care and supportive services. And these communities are therefore, unfortunately, at a competitive disadvantage for COC funds, based on what I had just said. Again, just something to keep in mind that due to some political decisions, some states will have fewer resources, and I will come back to that in just a minute. So there's obviously a lot that needs to go into the NOFA application, and I know everyone is very busy with the holidays and everything else, but I just want to take this opportunity to implore you to use this opportunity, use the fact that your community is going to have to be tiering and making these tough decisions to take action. Right now, like I said, you all have to make some tough decisions about programs in your community, and your members of Congress need to hear about those tough decisions and the ramifications they'll have on your efforts to prevent and end homelessness. This will have a direct impact, and your members of Congress, again, the people making these decisions, really need to know about this. Congress now has an opportunity to rework some of their funding bills, so we need to make sure that right now, before that January 15th deadline, that as many members as possible hear from us right now about the importance of providing an increase for the McKinney-Vento homeless assistance grants in FY 2014 to ensure that next year we can fund all renewals and expand our ESG capacity. So to loop back to the ACA Medicaid expansion, as I've mentioned, states that aren't expanding their Medicaid eligibility, a decision made by the governors, are now at a disadvantage in the NOFA. But similar to dealing with these cuts, to the NOFA cuts, the federal funding, there is something you can do about it. Homeless advocates in non-expansion states should engage in statewide mainstream advocacy efforts on Medicaid expansion. Like I said, it's a political decision, so it can be impacted. This is an important strategy for serving vulnerable people, expanding Medicaid, and for securing federal homeless assistance funding. There's important advocacy being done at all different levels of government to make sure we're doing the maximum to serve those experiencing homelessness. And in fact, there's a ton of activity happening now at the state level. So we've actually got some great materials on engaging in state advocacy, particularly around Medicaid expansion, and we'll be making sure that we send those up as a follow-up to this webinar, in addition to some of our federal funding advocacy materials that we'll also be sending around. So just to give you an idea of what the timeline looks like for the next few weeks, starting Friday, both the House and Senate will be on recess for the holidays and returning in early January. And when they get back, they'll have a fairly quick turnaround time to finalize those FY 2014 funding bills before that January 15th deadline. So they'll move pretty quickly. Therefore, they need your input now. We'll be sending out, like I just said, some follow-up materials to everyone that signed up for this webinar to make sure that you're all just taking a quick moment to reach out to your members as soon as possible with information on these cuts and your efforts to prevent on these cuts and any of your efforts that you're doing in your community to prevent and end homelessness. Remember, like I said, we must get an increase, a significant increase in the FY 2014 NOFA, or sorry, in the FY 2014 funding bills to ensure that we don't have further cuts in the next NOFA. As a reminder, which I'm sure you all know, HUD has said that once the FY 2014 funding bills are finalized by Congress, HUD will move quickly to release the FY 2014 NOFA. So hopefully we'll get back to a little more regular order here with things coming out a little more timely. So it's a great motivation to reach out to your members and encourage them to get bills with a McKinney increase passed as soon as possible. Finally, to go back to Medicaid, we've been hearing a lot about enrollment in the private exchanges for ACA in the news, et cetera, that March deadline that everyone keeps talking about. But as a reminder, Medicaid enrollment is ongoing and something you should be working on in order to ensure that we get as many people covered as soon as possible. So the sooner the better. So, for example, you know, if you're aiming to get as many people signed up by the January 1 deadline as possible, it's not an instantaneous process. Just a reminder, it takes about 1 to 2 weeks, so you really want to try and get those people signed up by about December 23rd. So it's ongoing, it's not instantaneous, you know, it does take a week or two, but just a reminder that that's something that you can be working on throughout the year. Before I pass it over to Norm, I wanted to share our McKinney campaign page, which you can jot down, or we'll be also sending it around to folks in that follow-up email. And if you ever have any advocacy questions or anything, you know, please don't hesitate to get in touch with me. I'd love to talk to you about anything that's happening in your community or reaching out to your members or anything like that. And before I turn it over, I did just want to launch a quick poll. I'm just curious to see how many people on the webinar are planning on doing some advocacy related to the next NOFA or around Medicaid. So go ahead and pick your answers. You can pick more than one, and I'll just leave this up here for a few more moments. Wait for everyone to respond. Thanks for everyone for responding. Put it up for a few more seconds. All right, thank you so much. That's great. Those numbers look pretty good. I will note that about 37% of you are not going to be doing any advocacy, and I would implore you to reconsider. I know that I'm sure there are some people on the call who have some restrictions on the amount of advocacy that you can do, but if you have any questions about whether or not you can conduct advocacy, and you'd be surprised how many people can conduct advocacy, even those that receive federal funds, of course, are encouraged to do advocacy. Please reach out to me if you have any questions about that. Really, as many people as possible should be doing advocacy. I cannot sort of emphasize that enough. We're really at a crossroads here, and we need to make sure that the 2014 bills have an increase. So with that, I will pass it along to Norm to go into the nitty-gritty details of the NOFA.
Thank you very much, Kate. So we're going to, please sort of bear with us. We're going to take a few seconds and change screens here. And everyone should slowly be starting to see my screen. Okay. So thank you, Kate, and thank you, everybody, for joining this webinar. I'd like to talk about several things, but I really sort of want to start by emphasizing the fact that we'll be talking a lot about strategies both that will help with this and future NOFAs and also focused on reducing homelessness. So one of the changes that we've been really encouraged by in the NOFA process over the last couple of years is how it's much more focused on reducing homelessness and strategies that reduce homelessness and providing incentives for communities that are making good progress. So first, I want to just sort of give a little overview of what the NOFA scoring looks like. So you have this sort of big pie chart that's coming up on your screen. Let me explain this just briefly. So what I did was I had a chance to go through the NOFA and add up all the points and categorize them. This is not the same set of categories that that are in the NOFA, but just to sort of take a fresh look at this. And as you can see, outcomes are really the major chunk of what the NOFA is about and what you can get points for. And this has been steadily increasing over the past several years. There are also a lot of points focused on chronic homelessness and on rapid rehousing, as you can see there. And the rest of the points are kind of divvied up among numerous different activities, including HMIS, point-in-time counts, coordination with other mainstream agencies, governance, and things like that. So clearly there's a huge emphasis on achieving outcomes, and where this is slightly different than in past years is the outcomes are not just focused on project outcomes, but also focused on community outcomes. And what we're likely to see going forward is just this emphasis increasing, both more outcome focused, but also more focused on community outcomes rather than project level outcomes. So let's talk about some of the opportunities and challenges that the NOFA presents. And I think there are, when reading through the NOFA, there are three really big ones that stand out. One is the project ranking and tiering process. Another is the opportunity and the challenges of doing reallocation. And then there are a surprising number of points, I think, that are relatively easy to get that are focused on how you prioritize admissions into permanent supportive housing. So we'll talk about each of these in turn. So let's start by talking about the project ranking and tiering process. And I think one of the important things to focus on is to avoid a strategy of just making across-the-board cuts to try and fit all renewal projects into Tier 1. This is something that many communities did last year. Part of that, of course, was the fact that it was a very brief time frame and it was hard to know what to expect or how to react. But this is something that HUD clearly was not impressed with, and just because of the way the NOFA is scored, doing this kind of prioritization can often lead to getting less funding. And there are numerous places in the NOFA where you get points for being strategic about how you allocate resources, and the sort of across-the-board cut approach is not a strategic allocation of resources. I just sort of put a little analogy at the bottom of the slide there about how doing the prioritization process is like exercising. It's always easier not to do it, to just stay in bed or hit the snooze button or have a longer breakfast or whatever. There are 100 reasons not to exercise. There isn't time. You're worried about injuries and things like that. But at the end of the day, we know that we're going to be better off both in the short run and the long run if we do exercise. And I think the prioritization process is actually pretty similar to that. At some point, everyone is going to have to be prioritizing, at least if you want to be competitive in the NOFA process. And there's nothing particularly helpful about waiting to do that. So even though it's a challenging process, even though it's difficult to come up to agree as a community on a prioritization process, it's something that's going to benefit everybody to do sooner rather than later, and certainly in this NOFA, if it's at all possible. So what are some of the things to consider in a prioritization process, a ranking and tiering process? The number one thing is again, focusing on the contribution of different projects to community outcomes. So I think it's important to make a distinction here between community-wide outcomes and project-level outcomes. So in many communities, the standard that they've applied is whether individual projects are meeting the thresholds that HUD set. So, for example, in permanent supportive housing, the percentage of people who remain in housing for at least 6 months. In transitional housing, the percentage of people who exit to permanent housing, et cetera. And what that focus on project level outcomes is diminishing a bit, and there's a much more focus on community-wide outcomes. And this requires a lot more thinking about how the project works and how it contributes to what happens in the community. So it's important to think about how does this project reduce the average length of homeless episodes, how does it reduce the number of people who, once they exit homelessness, return to homelessness, How does it connect people with income and benefits, et cetera? Another sort of factor that you can consider when thinking about ranking and tiering is the types of projects. HUD has clearly laid out their project preference, permanent supportive housing for people experiencing chronic homelessness, rapid rehousing for families with children experiencing homelessness, and so on. So that's another factor to consider in the ranking and tiering process. And then it's important to think about what's needed in your community. And household configuration is certainly one of the big ones. You know, how many families versus single individuals, youth, et cetera. And so these are all factors you'll want to consider when you're thinking about your ranking process. And I want to mention one more thing that I think is a really important part of the process when you're thinking about ranking and tiering, and that's the importance of having an open process that is transparent, well understood, and importantly, that's written down somewhere. When a community does not have an open and documented process for doing project prioritization, it can actually cause pretty significant problems in the COC process. Several COCs last year had all their projects held up while disputes were being resolved around the ranking process. So it is very important to try to meet the timelines in the NOFA and to have a process that's documented, written down, and that's open. So let's turn to discussing reallocation. So there's a lot to consider in reallocation, and there are a lot of challenges. But let's talk about some of the highlights of reallocation and some of the various issues to consider. First, just to be clear, looking at that blue box at the top left, you can reallocate from any project to permanent supportive housing for people experiencing chronic homelessness or rapid rehousing for families with children. So you can reallocate from a supportive services only project, from a transitional housing project, or you can reallocate from other permanent supportive housing projects, or there isn't much rapid rehousing funded by the COC yet, but you can reallocate from those as well. Looking at the green box, some different types of reallocation to consider. One is thinking about just a single provider who's looking to change the type of program they're operating. So the classic example of this is a provider who has a transitional housing grant and is providing transitional housing and wants to convert their project to either permanent supportive housing or rapid rehousing. This is something that has to be done through the reallocation process and is one of the sort of major types of reallocations that occur. Another approach is to look at cutting funding from many different projects to create a new or maybe a couple new reallocation projects. So I'm actually going to talk about one example of how you can do that in a second once we get to that red box down in the lower left corner. And then the other one is looking at providers, perhaps ones that are lower performing or who aren't interested in participating in the COC, or for one reason or another your COC is planning not to fund, and then reallocating those resources to another project. So various different types of reallocation. So let's talk about just sort of two ways to think about reallocation and types of reallocations to consider. At the lower left corner in the red box, there's the issue of projects that are consistently returning money to HUD. This is most common, I think, in what used to be called shelter plus care projects. And this had a lot to do with just the way the projects were inherently structured, that it was very, very challenging to spend all the money every year. And so one of the things you really should look at is if there are projects that return the same amount of money to HUD every year, to look at reallocating that portion of money. And if you have several projects that are doing that, it's not that challenging to reallocate a portion from each of those projects to create one new project. Even if you're reallocating from supportive housing projects, permanent supportive housing projects, to a new permanent supportive housing project, that can be a pretty effective reallocation strategy. And one thing that's important to consider is that once you do this reallocation, you can't then in future years request to get that money back as part of a renewal. So you want to be fairly certain that the project is going to continue giving money back, and you're going to want to consider how the finances of that project are managed going forward. But this is something that several COCs did, and were able to create new projects with essentially no harm to people experiencing homelessness in the community. The other thing that's worth considering is that HUD is this year allowing projects to request less than FMR for their permanent housing grants. So the way this worked in the past is that permanent housing rental assistance projects would receive the number of units times the fair market rent, and often it was challenging to spend all that money, and so they'd give back money every year. HUD is now allowing you to, say you're a 10-unit project, to keep the same number of units but to request, say, 90% of FMR or some lower percentage or higher percentage, and then you can reallocate the rest to other projects, and it just makes it easier than the way you used to have to do it, which is sort of to do over-leasing, and it was kind of complicated. So that's another thing to consider. Look at your underutilizing projects that are giving money back to HUD every year. Another thing to consider is, so looking at this purple box, there are a lot of challenges currently to doing a reallocation. One of the challenges that people face a lot is the issue of timing. Because the NOFA has been coming out late every year, there's a potential for having a gap in your grant. So let's say your grant starts, and we'll just make up a date here, April 1st, and you may not hear about, so your renewal runs out April 1st, you may not hear about your grant until early summer or midsummer or so, and then by the time the grant agreement is signed, it could take until the fall or so, and so your old grant would have run out and the new grant won't start, and then how do you, especially if you're one organization that's reallocating from one project to another, one project type to another, how do you manage that gap in funding? So one of the options that is worth considering is looking at a 2-year reallocation process where you reallocate half the project in the first year and half the project in the second year. This allows you to have some renewal funding that will let you continue operating for 6 or so months, or however long you manage to make it last, and then the new grant can pick up, and you can minimize that gap in funding that is created. It also gives you a little more time to sort of manage the process. Projects are rarely so clean that you can just sort of end one project on Saturday and start up a new one on Sunday. So doing a two-part reallocation process can be very helpful. The downside, of course, is that you, for a period, would have to manage 2 grants simultaneously. You can eventually, consolidate those grants, but it does involve a little more grant management. So those are some things to consider with respect to reallocation. And just quickly to go through the issue of prioritizing admissions, the NOFA has several points available for communities where you increase the number of permanent supportive housing units that prioritize people experiencing chronic homelessness for units that come available upon turnover. So if you have, say, a project that maybe it's a 15-year-old project, provides permanent supportive housing, has not been prioritizing people experiencing chronic homelessness, and now you can work together to start prioritizing people experiencing chronic homelessness. You can actually gain a significant number of points in the NOFA by doing that. And again, this is something that many communities have done to help sort of restart their progress on chronic homelessness. A lot of communities developed a lot of supportive housing, and there were some initial successes at reducing chronic homelessness, and then they've sort of stagnated a bit. And this is a process that will help sort of re-energize that process and jumpstart it a little. So those are some things, some important things that can help you with this NOFA and in the near term, but it's worth looking at the long term as well. And what are the things you can do over the long term that will help you in your both with your NOFA scores going forward, but more importantly with making progress on reducing and ending homelessness. And there are 4 big ones here to consider. One is a year-round focus on outcomes. Another is having a resource allocation strategy. Another is thinking about the way your homeless assistance system is designed and how it's supposed to work. And another one is the importance of having good governance. So again, we'll go through these in turn. Let's start with talking about a focus on outcomes. And I just have a couple of examples here about what that might look like. The first one is from Columbus, Ohio. We talk a lot about Columbus, Ohio. It's one of our favorite communities. One of the things that makes it so successful is the constant focus on outcomes and improving outcomes. And here is just sort of an example of one of their list of outcome measures that they use. And they measure these things on a very regular basis, doing quarterly and semi-annual and annual reports for all the providers and for the system as a whole. We have a nice write-up of how Columbus does performance measures, which includes not just the specific metrics, but how performance is managed and how they reward good performers and how they work with lower performers to improve performance. So that's one good example of focus on outcomes. Another one is Alameda County, California, where Oakland and Berkeley and other communities are located. So in Alameda, what I'm showing you here on the screen is an example of an annual outcomes report that they have started doing. And one of the charts from the outcomes report that's shown there is one of the measures that, again, is looking at contributing to community outcomes. And one of the outcomes that's obviously important is people moving into permanent housing. And there they have all the shelter providers, and I've sort of boxed out the actual names of the shelter providers. But what you can see is that there are some shelter providers who have great outcomes, and a lot of people are moving into permanent housing when they exit the shelter, and many with lower performance. So the key, though, is that the performance focus, the outcomes focus, does not just happen during the NOFA process. It's something that's happening year-round. They're constantly working on it. Allocating resources is another critical factor in helping make progress. So one of the tools that we've created to help some communities, this is something we've used in Virginia, is a resource allocation template. And so what this template does is it allows you to identify where resources are coming from and what sources they're coming from and what activities they're being used for, and then to have a community conversation about, okay, these are where our resources are currently allocated, but where should we be allocating our resources over the next 12 months? And then there's another section for how they should be allocated over the next 5 years. And that template is available on our website. It's a simple Microsoft Excel worksheet. And lastly, an important system design tool that we've developed is something called the Performance Improvement Calculator. And what this allows you to do is to model the impact of different changes in your homeless assistance system. So for example, if you shift resources from, say, shelter to permanent supportive housing or transitional housing to rapid rehousing or things like that, you can actually model how your outcomes will change. How many more people will you house, and things like that. And so again, this is a tool that's available from our website, and a lot of communities have started using this, and it does a very nice job of just showing you what the impact of changes will be. And then last thing I want to focus on is just the importance of good governance. And I think this is something that's going to come up in Kelly's discussion a lot, is that governance is the thing that makes communities go from just aspiring to achieve something to actually being able to make steady progress on something. And there's several important components of governance. It's important that governance is strong and actually has some ability to affect the various things that happen in a community. Ability to affect policy, ability to affect how resources are allocated. In fact, in general, it's the more influence that a governance entity has over how resources are allocated, the more progress a community is able to make. It's obviously important that they have competent people there. It's important that it be well-staffed. I talk to many communities who are just struggling with making progress. They do 10-year plans, they do a lot of planning, but nothing seems to get off the ground. And inevitably, you can trace it back to the fact that there's nobody whose job it is to do that, to implement plans, to implement improvements to homeless assistance. So having that function staffed and having the data function staffed is really important. And then it's very important that the governance entity has the trust and respect of the people in the community. It's important that the processes are documented, well written down. It's very important that the governance entity is doing outreach on a very regular basis, communicating with political leaders, with the general public, with providers, with other mainstream system leaders, etc. So that's the end of my presentation, and I think we're going to go ahead and turn this over to Kelly. So Kelly, again, is the Executive Director of Homeward in Richmond, Virginia, and they've really done a fantastic job at making changes, at improving homeless assistance, at finding new resources, and best allocating the resources they have. But I will let her tell you all about it. So Kelly, you're up.
All right, thanks, Norm. So good afternoon, everyone. The first slide y'all see is just a map of our continuum of care. So we do cover 8 localities and an unincorporated town. So we're in Richmond, Virginia, in the Mid-Atlantic. And then I wanted to give y'all a little bit of background on our continuum of care, just so you can see what we're talking about. I'm not sure how many, I've been with Homeward for 10 years, but at Homeward, we submitted our first COC application in 1997. And so we have an old continuum. We have some really strong providers, and we have a good mix of funded programs. But maybe like many of you, we don't, that funding isn't necessarily lined up with what we know today and the data that we have. Now, if we were starting today, our mix of COC-funded programs might look different. And that's important, I think, when we look at reallocation and shifting things over time. We know from doing, funding mapping like Norm mentioned, that we've been doing for a little while, that the COC dollars are about 10% of our homeless system, which, and when we sort of figured that out, it was a real light bulb for us that when we started in the late 90s and early 2000s, we really thought HUD was the primary focus of our community. It was the tail wagging the dog, and when we could put it in context that it is our single biggest funder of homeless services, but not the only funder, that sort of helped us to really look at the HUD funding as a piece of our overall homeless system and to figure out how we do performance measurement that really moves everything forward. All right, so then the next slide, thank you, Norm. We're really fortunate that our community invested in data starting a long time ago. So we've had time to do everything wrong, and now we're really benefiting from fixing those issues. We love HMIS. It really gives us outcomes over time, looking at things like rates of return to exit, and other, that annual snapshot. We also do point-in-time counts. We do them twice a year, and we really rely on those counts for the demographic information, the relative percentages of, family composition, or do we have singles or chronic individuals or families with children, and then identifying those unmet needs. The other thing, because we have a strong basis with HMIS and point-in-time counts, we've done other studies that really help us set our community priorities. And the most recent and compelling example for us was a study that looked at jail, incarceration, and homeless services. And so you'll see when we went to shift resources to address what we knew was the problem in our community, we used that data then in our HUD process and shifted some funding and reallocated to a program to address that community need. And, I think like many people, but maybe not everyone, our goal is really system change. We really want to end homelessness for our neighbors. We have a high poverty rate, and we know that these funds can really help focus on housing stability. So then, talking about, we have a lot of data, we really take community planning seriously. I wanted to just talk briefly about how we use performance measurement and then tying that into reallocation. So I'll just touch on who does the performance measurement for the HUD process. And Norm was really kind, but we do have some staffing to do that. Again, that's part of our community assessment. How we do it, how we've reallocated money to align with the data and the outcomes, and then where we would like to be, where we're going. All right. So we have a ranking committee, like many communities. So we're regional continuum of care. In Virginia, cities and counties are totally separate. But like everyone, people are people. They don't always get along. So Homeward being this coordinating entity has been really helpful in that context. We do have 8 jurisdictions, but our population is just about 1 million people, so just for context. We have a ranking committee that has local government staff. We have oversight of federal funds, not COC funds, but maybe ESG or CDBG or other sort of that experience with applying technical issues to funding applications. We engage a lot of private funders of homeless services on our ranking committee, and that's really critical, especially when we get to reallocating and identifying unmet needs for funding. We have service providers who don't get COC funding, but maybe ESG funded, but really providing that provider insight. And then we have individuals who are formerly homeless, and some of the other, someone in the other categories could also be formerly homeless. So on our ranking committee, we have a lot of technical expertise and some really in-depth knowledge of our providers. Okay. So even with that, one thing that we have been doing and we're really stepping up is that we provide training to our ranking committee on performance measurement. An example of that is that we've really, over the last couple of years, pushed the applicants to use their APRs out of HMIS rather than creating their own numbers, like really making sure that we have a systemic way of looking at that data. And then, last year's NOFA, we realized that we needed to train our ranking committee even more. So we've created a webinar on how to read the APR and, what is a leaver versus a stayer, and all those things. And that's on our website, which I'm sure Norm and Kate can share with y'all. It's not exciting reading, probably, right, because it's still an APR, but we think it'll be really helpful to help our committee do performance measurement. So we also, in the ranking process for HUD, we focus on the unique purpose of these dollars. We focus on exits to permanent housing because we know we can end homelessness, and that's what these dollars are for. We use our point-in-time data to try to shift, that old continuum funding, to shift it over time to be reflective of the clients that we see in our community. Yeah, there's a small example. We're actually not probably far off from the percentage of funds that go towards families versus singles, but where we are off is that a lot of that family money, family services are in transitional housing, when really locally we're really working to rapidly rehouse families because of what we know about our families, right? So we know that we're not quite there, and we need to shift how we use this funding over time. What we look at when we're doing the performance measurement is, the APR outcomes. We're looking at length of stay. We talk about who was being served. Again, because our committee knows the providers really well, whether someone's serving a higher barrier clients as opposed to something else. We do look at spend down rates. We've made some allocations, exactly as Norm mentioned earlier. And then particularly last year, we were looking even closer at income, outcomes around increasing income and the thoroughness of reach, because we really wanted to make sure we weren't cherry picking who was served with these dollars. So, when we sit down with our committee, we like to talk. We are a little bit Southern, so we do like to talk. And we look at the data and the outcomes and, our current mix of funded programs. We review our regional priorities from our 10-year plan, the data studies, like the jail study or other studies that we've done, looking at our outcomes and that client-level data. We look at other sources of community funding. In Virginia, we're really fortunate. We have a big emphasis at our state on increasing the capacity of communities to rapidly rehouse families. It's been very successful. The state has shifted some funding to do that, so then we can, sort of shift how we spend COC dollars in connection to these other changes in the funding. And then, this is really hard, but we remind ourselves that we have some great programs in Richmond, but they don't fit this pool of money. And it's really tempting to think, but oh my God, this is the only money we have. But it's not what HUD is intending for this money, and using money in that way isn't going to help us maximize all of the available resources. So we have reallocated, based on all of those conversations, looking at the data, which are conversations with clients, having conversations among the committee, looking, at all of that information. It is easy to start with unspent funds. We did that in last year. Captured some unspent funds and shifted them to the new priority programs for our community, so a new rapid rehousing project and something, permanent supportive housing for those individuals with serious mental illness who are in and out of jails and shelters. We've have some shifting, so this is, again, it's incremental over time, shifting to priority programs or program types, from transitional housing to rapid rehousing. And our community has been really successful, and our providers are now leading this charge. But it is part of this systemic change of where we're trying to take our community. And we have defunded programs that were, effective, but they weren't focused on exits to permanent housing. And that really came out in the APRs, looking at the outcome data, that it just wasn't there. And so that's where our committee members, particularly the private funders, could say, oh yeah, that's a good program, but it doesn't fit here. And then because they're in the room, they can say, this is a need. We have to help figure that out. And we don't always have the answers, but we know where we need to advocate for other kinds of funding. And I think that's particularly true with substance abuse. So where we'd like to go, we're fortunate in Richmond that we have Homeward, which is a planning agency, and dedicated staff and investment in data. But we also are developing our community COC governance, and so we're hoping to be more community-based with less reliance solely on Homeward staff, because there's decisions that we can't make, so they just haven't. There's still some hard conversations that we haven't had yet, but we're gearing up for. And I'd say the ranking committee for the COC process is a core of this new structure. It really is the model for what we see under Hearth. So that's it's good to know that we have that basis. We are developing a performance measurement committee, bringing in a lot of data folks from across the community, from universities, Fair Housing Organization. We do focus on incremental change over time. We don't want to put anyone out, but we do want to remain effective and competitive for funding. And then, at Homewood, we continue to educate funders about the range of needs, funded through HUD or otherwise, and what good outcomes look like. And so, that's sort of a nice transition to how we then use this information for advocacy and public education. My agency doesn't, our board hasn't taken a strong policy on advocacy because we have such a mix of government and corporate interests on our board. But we work really closely with our state and our state coalition, the Virginia Coalition in Homelessness. But we do a lot through just public education, like this is what's happening in our community, and that's been effective. So I wanted just to share some of the messages that resonate in Virginia. These may not play well in other places, but in Virginia, I've found just last couple of years that focusing on stats about outcomes has been a little bit more impactful than just stories. But we sort of combine the data with stories through infographics. But really, the numbers have started to be more compelling, and that's a change, I think, for us, that both with the media and with politicians, that they're really appreciating the statistics, which is great because we have them. We do make a business case on ending homelessness, and that's important. That plays pretty well in a purple state where everything is either bipartisan or not necessarily friendly to human services, but by really focusing on outcomes and cost effectiveness and the changes over time, that it's not falling on deaf ears, which is good. This may sound goofy, but we say, look, our part of the government is working. What we're doing in homelessness and our partnership with HUD and the VA and other federal agencies is really impactful, and that's played well in Richmond. We remind our federal and state partners that homeless services leverages a lot of money, and so where we can say HUD is 10% of our homeless services system, it's a very important piece, but it's not the only piece, right? There's a lot of private money here, and again, that's sort of encouraging the politicians that their money is being used and more than, quadrupled in the community. Back to, don't punish success. Like, look, this is working. Additional cuts can threaten that, but we've been making our system more efficient. We relate to state priorities. Virginia is a very veteran-heavy state. The state is trying to be one of the most veteran-friendly states. So we can talk about, permanent supportive housing, rapid rehousing, how these strategies are working with veterans. And it's pretty cool that everyone in Richmond is now a champion for rapid rehousing. So now our politicians are talking about it, our private funders think they invented it, frankly, which is great, right? Because they're all as invested as we are in helping our neighbors get back into housing. So I'm going to turn it back to Kate, and I will stay on the line. So thanks.
Thank you, Kelly. And just a reminder to everyone to go ahead and enter any lingering questions you have, and we'll get to them in just a second. But to wrap up, I did just want to tell folks something that I'm sure they already know. This year's NOFA requires communities to really look at their systems and start focusing on what works. It's challenging, of course, and I'm sure it will be all-consuming until February. But this NOFA contains an added challenge that simply doesn't need to be there: figuring out what to cut. I can't emphasize this enough. These cuts don't need to happen again. We know you're very busy, but a 10-minute conversation to your member's office can have a huge impact in the amount of resources we have to address homelessness. The Alliance feels very strongly that we want you to focus on the NOFA, and we want you to sort of take the approach that we've been discussing on this webinar today. But no matter how busy you are, it's really worth the few minutes it takes to ensure that we have the resources we need to keep addressing homelessness in our communities. And we really hope that you agree with that. We understand it's all-consuming at the moment, but this is a really important opportunity and a really important time to make sure that next year we don't need to have this challenge again, and we have what we need. What we need to keep working on ending homelessness in our communities. So with that, I will turn it over to Anna and Lisa for some questions.
Great, thanks, Kate. I just have one quick question. I'm sure a lot of people are thinking this. When will the webinar be hosted online? We try our best to do that as quickly as possible, so probably by tomorrow at www.endhomelessness.org you can find this webinar and the PowerPoint slides. So,
I will add that as soon as the webinar recording is available, we'll be sending it out to anyone that registered for the webinar, along with some of those extra materials that came up throughout the call.
Great. So our first question is just a clarifying question for Norm, and this is about who can administer rental assistance.
So this is it is sort of a clarifying question, but it has an amazing amount of complexity to it. So currently, for both long-term rental assistance, permanent housing rental assistance, so the kind we're used to through Shelter Plus Care, and also for short and medium-term rental assistance, like what you're used to from HPRP, it has to be administered by either a public housing authority or a unit of local government or state government. So that means, and administer means something a little different than it does in other contexts. It means that the PHA or the government entity has to be the one that's contracting with the landlords to make payments, and they have to be the ones doing the unit inspections. But the other parts of administering the grant process and other things can be done by the nonprofit entity. The other thing that's happening here, though, that's worth mentioning is that we are working diligently with Congress to try to change that. The requirement that a PHA or unit of government be the one that has to administer rental assistance has been kind of problematic. I'm sure many people on this webinar have sort of felt the frustration with trying to put those kinds of projects together, partnering with a government or a PHA, especially around short and medium-term rental assistance. So we're actually fairly optimistic about being able to have that change made in the very near term. It is not something that would change before the NOFA is done, but it is certainly something that could change within the next few months. So that's the deal with administering rental assistance.
Great. And the other elephant in the room, a lot of people have asked varying questions about when a reallocation can occur. Is it ever possible to do a reallocation through an amendment? Can I do a reallocation without doing a competitive process? Can you just clarify how that works?
Sure, and again, there are some complexities here, so I'm just going to sort of give an overview and try to be as clear as I can about this. So a reallocation sort of by definition cannot be done through an amendment because it's sort of a reallocation is defined as this process where you do it through a NOFA and not through an amendment process. They generally call it repurposing when it's through the amendment process. But what I think the question is really about, obviously, is if you want to make a significant change to your program, when can you do it through an amendment process? When do you have to use the NOFA and the reallocation process? And the answer basically is that if you are making significant changes to your program, and that includes a change to the type of program, so if you're going from a transitional housing grant to a rapid rehousing grant, or from a transitional housing grant to a permanent housing grant, permanent supportive housing grant, then you are going to have to do that through reallocation at this time. It's possible that in the future there would be other opportunities, but right now you have to do this through the reallocation process. There are some other significant changes that would probably have to be done through reallocation if you were going from, say, serving unaccompanied individuals to serving families. That's something that would probably have to be done through reallocation if there were significant changes to the way the program was running. That would probably have to be done through reallocation. Smaller changes like small moves from one budget line to another, those things can, or smaller changes to the way the program works and things like prioritizing people experiencing chronic homelessness for admission into turnover units. those are things that can be done. Well, some of those things don't even need an amendment process, like the turnover issue, and others can certainly be done through the amendment process.
Reallocation is by far, I think, the thing that most people have questions about. So if you don't mind, I'd like to just delve a little deeper into that. Is it possible to reallocate to coordinated entry?
So at this time, it's not possible to reallocate to coordinated entry or coordinated assessment. This is something that HUD did allow last year for supportive services only projects, but this year that's not allowed. You can only reallocate to one of the two permanent housing types, either permanent supportive housing, and even then only for people experiencing chronic homelessness, or to rapid rehousing serving families with children.
So that would also include HMIS?
You cannot reallocate to HMIS. That's correct.
Great, thank you. So this next question I'd like to ask of Norm, but also Kelly, I think it would be interesting to have you weigh in here. Could you give some thoughts on how many staff a COC might need in order to be considered having a strong governance structure?
Sure. I think Kelly, maybe Kelly, you can talk about how many staff you have and just sort of the size of the, the Richmond COC, and to give people a sense, because I feel like you guys, may not be ideally staffed, but you certainly are able to do a lot of things that most other COCs aren't able to do.
Right. So, as I mentioned, our metropolitan area is about 1 million people. Our point-in-time count is just under 1,000, so that was big for us. We get between $4.5 and $5 million from HUD through the COC process, and at Homeward we have 6.5 staff. So myself, 2 people in program, 1 person whose primary job is the COC application, and then an events person. We have an operations person, and then we have 2 people on research and HMIS. And we do HMIS for more than just our COC. We do it for some other communities. So that gives a sense of what we have, in order to get that work done. But we have some incredible partners. We work probably with 30 to 40 agencies and really closely with 4 local governments, although we're increasingly engaging the other 4. So it's a lot of meetings, a lot of coordination, but we have great partners, working on committees and being involved. So it takes a lot of people, I think. That's right.
So could you...
Yeah. Sorry, if I could just add, and I think that's really sort of at the, Kelly has a really sort of impressive staff there too, and I think that's sort of, a smallish organization for all the things they're trying to do. And what I've learned in, working with communities around the country is that the investments in staffing for governance really do pay off in numerous ways. It's much easier, not easy, but easier to get more investment into the system, and you can just make everything run so much more efficiently, and you can get ahead of things. You can do both putting out fires and long-term strategic planning.
And I also just wanted to ask Kelly, how many people are on your ranking committee?
So the ranking committee varies a little bit each year depending on people's availability, but we have between 8 and 10, I would say, and again in those different categories. So local government, people who have that more technical expertise, private funders, our United Way, a community foundation, a family foundation member, service providers who aren't applicants and don't have that history, and then individuals who are formerly homeless. We also have some members who are from mainstream resources. So again, they get, it's that bigger picture piece.
And so Kelly, just if I could just jump in and ask a question, how has that helped with having those mainstream partners involved in this process? How has that helped sort of maybe give you an avenue into their resources as well? Because I know we have some questions about Medicaid and how do you approach the healthcare world and how that works.
Right, and we're not a Medicaid expansion state, although we have a new governor coming in, so just with that caveat. So some of the, I think in two ways. So in the mainstream resources, it's really been a way to do really deep education for key partners. So we have a long-term member who's with our disability resources, and that's actually helped her involvement and knowledge of the COC process has helped develop partnerships, and we think has led probably to more services for people from the agency she represents. And then with the private funders, I mean, when we sit around saying we have to say, well, we can't fund that program with this funding, then those funders can go back to their grant-making committees, typically with very wealthy individuals from the community, and say, oh, here's a great program. Or this agency needs this kind of support. Like I said, our funders love rapid rehousing, and they're really investing, so then we can figure that into our calculations when we're doing COC planning.
Uh-huh. And have they all been similarly helpful in doing advocacy, both at the state, federal, and local levels?
So our advocacy, and some of our funders have supported advocacy efforts, but I would say, I'm not sure if they're doing all of the things that Kate has asked us to do, right? But what they are doing is they're having conversations at restaurants and country clubs, and we see the impact of that. I mean, Virginia as a state, in my 10 years with Homeward, we went from being, we don't really care about homeless people to now we're, a state that's leading the drive from a statewide response to homelessness. And part of that, I mean, there's a lot that contributed to that, but, part of it is just having those conversations, and then the people that we talk to other people. And so it's, small A advocacy that has made a big, big difference.
Mm-hmm. Great.
So we have on the line here our Affordable Care Act expert, Lisa Stand, and we have an Affordable Care Act question that I'd just like to direct to her quickly, and that is if a community is interested in partnering with other organizations to benefit people who are experiencing homelessness, who are, in light of the Affordable Care Act, who are the partners that they should be reaching out to?
Thanks, Anna. This is Lisa, and hi, everyone. And that's a great question. And I'll also just reinforce what Kate said, that the NOFA is really very flexible in different ways that Affordable Care Act and Medicaid can be engaged. So even if you're not an expansion state, there are things you can do. The most important thing is getting benefits to people and enrolling people. And what we've been telling everyone is really, if you're a housing provider or you're working in the homeless assistance field, reach out to the community health center that you work with the most or know the best. It could be a federally qualified health center, or it could be a healthcare for the homeless grantee. But that's really your first step, and to make sure that everyone who's entitled to the new benefits are going to be signing up for them. And then just a little bit, I really appreciate in a non-expansion state or a state where you maybe have to tread a little bit lightly in state advocacy on Medicaid enrollment. The most important thing I think housing and homeless groups can do is really tell the story about how permanent supportive housing addresses chronic homelessness and how that benefits communities as a whole. You don't have to necessarily, take on a state legislative kind of agenda to just press that story home. And I would also direct you to the Alliance website. We have a section on healthcare which has a lot of resources to help you tell that story, to help sort of craft messages that will resonate with healthcare and health policy and health provider audiences. And then if you want to go a little bit further, I would recommend contacting your state primary care association. And I think then also disability groups, that's a great idea, that they will be able to plug you in very quickly.
Great. Thanks so much, Lisa. We have a couple questions about prioritization for chronically homeless individuals. And could we please, I think I'll direct this question to Norm. clarify, is that just for permanent supportive housing, or does that include transitional housing as well?
For the specific case of the points on the NOFA, it is for permanent supportive housing, not for transitional housing. That's not to say it may not be a good idea to prioritize transitional units as well, but the points available in the NOFA would just be for permanent supportive housing units dedicated to people experiencing chronic homelessness.
And to piggyback off of that, is there a best practice model that communities can look at as far as how to prioritize beds that turn over in permanent supportive housing for chronically homeless individuals?
I'm not aware of anything that's written up about that. There's certainly a lot of material on serving chronically homeless, on serving people experiencing chronic homelessness in permanent supportive housing. I will also say that we have a guide on our website, which is a guide on becoming a Housing First program. And if you just sort of type that into our search box, it should pop right up, which is really about looking at program changes like the kinds of changes you would need to in a permanent supportive housing project to serve people experiencing chronic homelessness, and it provides some examples of different tools you can use to help work your organization through that process. But I'm not aware of anything that's sort of written up like that. It wouldn't surprise me, though, if there is something written up, but I'm not aware of it.
This next question is for Kelly. Could you talk a little bit about how some strategies organizations or COCs could use to create the political will to move away from funding supportive services only in transitional housing projects and reallocate to new projects?
Right. So I think this is where the data really comes in. We started to build that political will with a small demonstration a couple of years ago to do rapid rehousing. And we really saw an immediate impact from that, and then being able to talk about the outcomes and it was a dramatic reduction in the length of stay. But we are pretty good about getting our data out there, and we now have infographics, which are my favorite thing, and they're all on our website, so y'all can see them. But using that data to make a difference, and then bringing so political will, like legislators or people of influence in the community, bringing them to some of our events where they can see that in action, where they can see the benefits of a coordinated system. But in terms of political will among providers, that's been a little trickier. So I don't know if that was part of the question, but it's been a long evolution. And I will say, when we started talking about moving away from transitional housing, we got the crazy-eyed look, which probably some of y'all have gotten. But it's been with the providers doing it and then having more funding to do it, and then their staff doing it, that now some of the people who really didn't think it would work are our biggest evangelists for it. So that the staff on the ground have been able to see that they can have more impact with their clients, that they can really help, like a mom with her kids, get stable, and so they're seeing that. Again, it's not 100%. I mean, I still, every month someone says, well, we had someone fail out of rapid rehousing, and so then we just remind them that it's better, the outcomes are still better than what we see in shelters, where it's a much higher rate of return, but we didn't talk about that when we didn't have these new options. So I think it's continuing to talk about the data, talking about the outcomes, talking about the cost effectiveness, and talking to everyone, right? Not just convincing the one person you're trying to convince, but everyone. And so then, people hear it from more than one place.
Great, thank you, Kelly. So we have a couple questions, and this I'll direct to Norm, about if you capture funds from organizations or projects that are consistently returning money to HUD, and you want to put that into a different project, and we have a couple. What if I put it into PSH? What if I put it into transitional housing? What if I put it into rapid rehousing? Is that considered a new project?
Yes. So I think the temptation is to see if there's a way you can sort of make your renewals bigger by shifting money around, but that's not allowed. You would sort of the way this works is that if you sort of cut out the money that's reduce funding for projects by the amount they've been giving back to HUD, so you're sort of trying to carve out the unutilized funding and then put it into an existing project. That what you'd have to do is create a new project, and so that organization would essentially have a renewal grant and a new grant, and then in a future year they could consolidate those grants and combine them. But for at least a period of time, you would have to operate essentially with two grants. So you cannot make a renewal grant bigger. You have to create a new grant, new project.
Great, thank you. This next question is for Kate. We have a gentleman who would like to know what he can do advocacy-wise in 5 minutes, if that's all he has.
That's a great question. We have, I think the best thing to do would be call your member of Congress, the representative, or one of your senators, and ask to speak to the person who handles housing issues, and just tell them that HUD, McKinney-Vento, homeless assistance grants need more money in FY 2014. That's really the #1 message, that they need an increase, they need more money to keep operating and doing the great things. The more specific you can be about what's happening in your community, the great things that you're doing. You can use the most recent PIT count numbers to say that we had a decrease and it's because these programs work, or we had an increase in our numbers and it's because we just don't have sufficient resources to address the problem. That would probably be the most streamlined, quickest thing you could do.
Great, thank you. Norm, did you see any questions that you wanted to pull out here?
I was just looking through the questions, and there are a lot of interesting ones. I did one of the things that's come up that I wanted to talk about, actually two things, one about outcomes, one about coordinated assessment. There have been a few questions in here and in other places around what exactly HUD is looking for in the coordinated assessment process. It seems to be de-emphasized in some sense in this NOFA process. And in speaking with a lot of people, I know that it's not being de-emphasized, but that HUD is taking a very flexible approach to coordinated assessment and allowing communities to develop whatever process they feel is best for their communities. So you won't have a ton of guidance from HUD about exactly what your coordinated assessment process should look like. But at the same time, you won't be, losing points over a poor coordinated assessment process because they recognize that it's the importance of, considering all the various local factors in how that coordinated assessment process works. And the other issue is about outcomes and longer-term tracking of outcomes. And this is, I think, an important something you saw in the NOFA a lot is this sort of statement about that whatever your plans are for the future, you should make them realistic because we're going to be tracking in future years how you did on what you said you would do in a previous NOFA. So, for example, if you say in this NOFA you're going to develop 50 units of, say, permanent supportive housing, then one of the scoring factors in future NOFAs is going to be, did you create 50 units of new permanent supportive housing? So in a very real sense, for many of these measures and outcome factors, this is a baseline year. This is where you're sort of setting your baseline for what you have and what you're going to be doing going forward. So it's very important that you sort of think about this as this is the start of an outcome process that we're going to commit to for years to come.
Great. I think that that's all the time we have for this webinar, unless anybody wanted to ask one final question. Okay, great. Then I'll turn this over to Kate to wrap up.
Thank you. Don't think there's too much more to add. Please do keep an eye on your inbox for the email we'll send around with some materials and action items that will hopefully get out to you all tomorrow. And again, this webinar will be recorded, put on our website, and sent to you in an email, the email that you used to register for this webinar. Norm, could you go ahead and put up our contact information, the contact information slide?
Oh, yes, sorry.
And this will also be in the recording that we send out to you. But if you have any questions, please don't hesitate to reach out to any of us. We're here to help you with your advocacy and the NOFA. So our emails are up there. Feel free to jot them down, or you can just get them when we send around the recording. Thank you all so much for joining us today. I hope you all have a wonderful holiday season, and we hope to hear from you soon. Thanks.
The organizer